Hi, I'm here with Corey Saltin. He's the president of the Mass Lung Allergy Foundation.
Yeah.
And that's that's associated with the HealthAlliance Hospital.
Yeah.
You're a pulmonologist.
That's right.
And you're working on a lung cancer screening. Why don't you tell us about that?
Sure, yeah. So my practice, Mass Lung Allergy, a group of physicians that treat patients with lung disease, COPD, emphysema, asthma, and we focus on lung cancer. For several years now, there's been a lung cancer screening test, a CAT scan, that's been available. And over the last year or so, it's become more well covered by insurances. Still, a lot of people aren't getting the test done. So we started the Mass Lung Allergy Foundation as a way to raise awareness of the test, not just to patients, but also to primary care physicians who may not
who can suggest the test.
Exactly, right. And so part of what we do is to raise that awareness. The other part of what we do is to try to help people gain access to it, because there are a lot of people that don't have insurance, and even people that do have insurance, sometimes it's not covered.
They have high deductible.
High deductible, exactly. So through the generosity of donors, the Mass Lung Allergy Foundation is now able to cover the out-of-pocket cost for the test, so money is never a barrier to anybody getting the test done.
That's fantastic.
Yeah, so we're trying
to this is for high-risk patients of lung, that are high risk of lung cancer. Smokers, past smokers.
Yeah, so it's specifically for people who are the ages 55 to 80, who have either currently still smoking or have quit less than 15 years ago. And we have to add up what's called a pack year history. So that means you have to have smoked for at least 1 pack a day for 30 years, or a half a pack a day for 60 years, or 2 packs a day for 15. So just all you do is you multiply the number of packs that you smoked a day on average times the number of years that you smoked. If that number is 30 or more, and you're between the ages of 55 to 80,
then you may qualify.
You may qualify if you're still smoking or quit less than 15 years ago.
And this special chest CT scan helps detect lung cancer early.
Yeah, the issue with lung cancer is that the prognosis with it is not particularly good, because by the time that people develop symptoms related to the lung cancer, it's often spread. It's often at an advanced stage. This CAT scan has been shown to identify lung cancer in patients early on, when it's an early stage, and treatment options are much more available, and the prognosis is so much better. So we don't want people to wait until they have symptoms. We want them to get the CAT scan done if they are fitting into that category that I just described. And And if you need assistance, there may be help available. Money's not going to be a barrier for anybody. We have the funds to do that, and we're continually fundraising to try to make sure that that money doesn't dry up, so we can continue to offer this program. Because it's less expensive to treat you early on, too. Correct, and it can save your life. If we diagnose lung cancer in a late stage, the prognosis is not as good. And a lot of people don't realize, but 1 out of 4 lung cancer deaths in this country is due to lung cancer. More people are going to die this year from lung cancer than colon cancer, breast cancer, and prostate cancer combined. Wow. So it's a really big deal. Like you said, this is the mammogram of lungs. It's the mammogram of lung cancer, that's right, exactly. And so we're really just trying to raise awareness of the test and increase access to patients who may not otherwise be able to afford to have it done. So if you fall in that category, then how do people contact you? Sure, so we want everybody who may be a candidate for this test to talk to their healthcare provider, talk to them and find out if they are a candidate for the test. And if they are, ask their doctor or nurse practitioner or physician's assistant to order the test for them. What's the test called? It's a lung cancer screening CAT scan. Lung cancer screening CAT scan. Totally non-invasive. No needles, no nothing. So it's really an easy test for patients to go through, and it really can save their life. Once they have the test ordered, we want them to call our foundation at masslung.com? masslung.com, or they can call us directly at 978-466-2692. They need to enroll with the program before they get the CAT scan done. Once they do that, we'll take it from there. And we'll ask them for some very basic information, but no financial information. There's no income requirements. You can make as much or as little as you want to make, and you're still going to qualify for the test as long as you qualify. You're going to qualify for the funds as long as you qualify for the test. That sounds great. Yeah. All right. Thank you so much for coming on and telling us about this lung cancer screening. Thanks for having me. I appreciate it. Corey Saltin, thank you so much.